Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 2 new cases of COVID-19, bringing our total to 257. The total number of COVID-related deaths in Manitoba remains at 6. As of this morning, 7 individuals are hospitalized. Of that, 3 are in intensive care. 154 individuals are listed as recovered. There are 97 active cases. Public health investigations continue to confirm details, and information will be updated online as it's available. There were 440 tests performed yesterday at Catham Provincial Lab. A total of 21,601 tests have been performed since early February. As announced late last week, we have expanded testing criteria to include all symptomatic workers or volunteers who are still going to work outside the home. This includes people working in construction, in transportation, in manufacturing, in grocery stores, at daycares, and all other critical businesses. So to be clear, if you're in an industry that was not required to close as part of the public health orders and you're symptomatic, then you are eligible for testing. Any symptomatic person who lives with a healthcare worker or first responder or worker in a congregate setting, such as a correctional facility, shelter, long-term care, or residential facility, are also eligible. I want to encourage any Manitoban with respiratory symptoms, even if they're mild, who meet our criteria to get tested. Our criteria have included for some time any Manitoban who's traveled outside of Manitoba in the past 14 days, close contact with a confirmed case, all healthcare workers, first responders such as police officers and firefighters, lab workers who have worked with COVID tests, and individuals who live or work in the north or a remote isolated community or a group setting, such as people living in correctional facility, shelter, long-term care or residential facility, or a remote work camp. So our testing capacity has been increased, and we can accommodate many more tests than have been submitted. So again, if you are symptomatic and meet any of these criteria, call HealthLinks, and information can be provided regarding the need for testing. We continue to remind Manitobans that there should be no non-essential personal travel. Every Manitoban, regardless of where they live, needs to adhere to the social distancing strategies to stay home as much as you can, wash your hands frequently, leave home for essentials only, and if you do, then ensuring you're adhering to physical distancing, keeping that 2 meters separation. This advice includes only traveling to a cottage or second residence if needed. If people must travel, they are encouraged to only travel with household family members, not visit others on arrival, avoid stopping for gas or other supplies on the way, and only visit local health providers in case of emergency. So even if you are traveling to your cottage, do so only if required, and if you do, need to limit your contact with all others. This virus is in every health region of Manitoba, so all Manitobans need to adhere to social distancing strategies. And I want to thank Manitobans for their efforts to following this advice. We can see from our numbers that many Manitobans have stepped up to limit the transmission of this virus in our province. To date, we have not had significant community-based transmission or outbreaks in personal care homes. We have now been able to increase our testing capacity and expand our testing criteria. Our healthcare system has been preparing and is equipping itself to handle certainly the current caseloads. Right now, the direction is still to adhere to our social distancing strategies, which have been working, and so we need to continue those efforts. But in the coming weeks, we are going to be looking at ways that we can ease these restrictions. We're going to look at ways to safely reopen certain non-essential businesses while others will remain closed. However, this will not be a return to normal. There will be a new normal for the foreseeable future. We'll need to continue our social distancing strategies, although we are going to be able to ease some of the restrictions. but Manitobans will need to be dealing with this virus for the foreseeable future. So we're going to reopen things. We're going to do so very cautiously and follow our numbers. We're going to share more information and details on that as they become available. I want to continue to ask Manitobans to access credible information, our website, manitoba.ca/COVID-19. And thanks again to all Manitobans for stepping up to help flatten our curve, to limit the transmission of this virus in our communities. And again, thanks to our healthcare workers on the front line who have really stepped up and in the service of Manitobans. So thank you. I'll pass it over to Lanette.
Thank you. So today I would like to start by thanking everyone who's involved in children's education. It's been quite a disruptive time with them being at home and learning, having to learn in different ways in different environments. So this pandemic has been a bit of a challenge for everybody. Learning from home can be challenging for our kids at the best of times, but it's especially difficult for families who don't have laptops or tablets or smartphones or internet access. We heard recently about a teacher in the Winnipeg school division who's been going to the homes of her students, her young students, and reading them books from the sidewalk while they sit on the step of their homes. And I think that's just an incredible story of dedication, and the school divisions as well have stepped up to, including Seven Oaks and Louis Riel, to loan laptops to families who need them to help students learn. We've now heard that Bell MTS has generously been providing internet services for students who need it while the classes are suspended, beginning with 200 homes in the Seven Oaks School Division area. These are such worthy initiatives that address the educational needs of Manitoba children. And so I would like to congratulate the work of the educators who are staying connected with their students during this time, and the parents who are changing their schedules and supporting their children to learn, and also to Bell MTS for doing their part to help out. So thanks to all on that. I'd also like to provide an update on the health of our clinical providers. To date, our occupational health group has reported 25 healthcare workers who have tested positive for COVID-19. There have been 4 new cases in the past week, and I will give you a breakdown of those. There's 789 staff members who have been tested for the virus in the past 7 days. 23 of the 25 positive cases are employed within Winnipeg, and 2 are from Interlake Eastern. There continues to be 0 cases involving workers in Prairie Mountain Health, Northern Regional Health Authority, and Southern Health Santee-Sud regions. Of the 25 cases, we can share that 8 are nurses, 5 are medical staff, and 12 work in other areas of allied health or support services. 15 staff have recovered from this virus and have now returned to work, and we are very happy that they are well and that they are back with their teammates. I'd like to thank everyone who has stayed home when they are sick and who has practiced physical distancing and meticulous hand washing, because that has really contributed to flattening the curve and keeping these numbers as low as they have been. So thanks to all. And I also want to thank public health, the expedient way in which they are contacting positive COVID cases and doing the contact tracing has been really helpful so that we can locate the people and get them in isolation and assess the situation as quickly as possible, as well as the staff who are screening healthcare workers on their way into work. I get to go through that every day, and they're very lovely people, and it's a very reassuring part of my day. Finally, I would also like to say to let you know that it is National Volunteer Week, and volunteers, of course, play an integral role in our hospitals and facilities, supporting staff in a variety of ways to enhance the level of care that patients receive. That has continued during this pandemic, albeit with restrictions designed to limit the spread of the virus. Volunteers continue to help the health system in a variety of ways, such as helping out at dedicated testing sites, at our call centers, or with employee assistance programs. So on behalf of the staff, the patients, the clients, the families, the residents, I want to thank every volunteer who dedicates their time to helping. We are humbled by your compassion and your commitment and your dedication. If you are in Winnipeg and you are interested in volunteering, you can contact the WRHA online, wrha.mb.ca, and there are volunteer opportunities there. And if you live outside of Winnipeg, you can connect with your regional health authority and get connected that way. And of course, all potential volunteers will be screened for COVID-19, as is our usual protocol right now. So with that, we can open up the lines to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, you touched on this, and this morning the Premier also talked about possibly releasing plans next week for getting the economy back on track and loosening restrictions. Can you give us some more details on what that would entail, and talk a little bit as well about the process that goes into it to ensure that the plan is in fact a safe one and doesn't cause a second wave of COVID or another flare-up?
Right, so that is really the issue, is that we know we need to ensure we can get the economy moving as soon as we can, but we have to do it in a cautious way. We have to ensure we are monitoring our numbers as we do that. So we have a list of criteria that need to be in place that will make it safe to start gradually reopening things. I don't have a lot of details that I can share right now of what it exactly looks like, but it will be a look at some of the non-essential businesses that have been closed at this point, to look at ways to open some of them with restrictions to ensure that we're limiting the impact. And then certainly gradually reopening things, giving a sufficient amount of time to assess the effects of those openings before moving further with any further ones. So that's what we have now. We'll have probably some more details next week to share on that.
Thank you. And my follow-up, yesterday you said we need 14 to 18 days of low numbers like we're seeing to look at loosening restrictions. We have had low numbers of 201 new cases a day for a while now. Can you tell us where we're at on that timeline? Or is it 14 days of having 0 cases?
Right, yeah, so it's a range, and there's no set number on this. Some suggestions are to have 0 cases, 0 community-based transmission, and some people will say that should be a period of 3 to 4 weeks. Some people would suggest 2 full incubation periods, which would be 28 days. And so there's no real set number. We have a number of factors, not only the number of cases, but we will be looking at around that 18-day mark, to the 3-week mark. But we need to also look at a number of the other factors, such as healthcare system preparedness, the ability to ramp up testing, which we've already been doing, things like our personal protective equipment. And so there's a number of factors that we look at, and none of them have a set number. It's just it's a range that we'll look at. So but if we look at that 3 to 4 week range is sort of the guide.
From the Brandon Sun, Bud.
Hi, Bud Roberts from the Brandon Sun. Lanette, unions representing healthcare workers seem less than impressed with the zoning system for PPEs, and they say that their argument that they should all be wearing the PPEs anyway because there may be someone who is carrying the virus, is not showing symptoms. What is your response to their arguments to that?
Yeah, so the meetings will continue with the unions to work through the PPE document, the recommendations. We have had feedback from occupational health as well as infection prevention and control as to what is the evidence telling us, and looked at other jurisdictions in terms of what they have moved to in this phase of the pandemic. So as we continue to see low numbers and we continue to see the active cases decreasing, certainly we want our staff to be safe, but we also have to have that balance of, taking steps to how do we move forward. And so I think, we've had expert eyes on that. So we're open to having more conversation, but at this point, we need to make sure that those who are in the high-risk settings in high-risk situations need to have the PPE available to them, and also make sure that it's reasonable and appropriate for all staff.
All right, thank you. And Dr. Roussin, fire's still under your feet regarding these projections and modeling. I know you say it's early, but I was wondering, is now the time maybe to put out some preliminary projections or some, considering they're all going to be up in the air at any rate, regardless?
Yeah, so we are working on that, and I think we're going to. The plan has always been to try to get them out to show Manitoba and some of these things. It's important to note that these numbers aren't a crystal ball. They're not going to tell us where what we're actually going to see. They're just a few projections of certain eventualities. But nonetheless, we do want to try to get those numbers out. So I can't commit to a date, but we are going to try to do that in the near future. Get some of the projections out there so Manitobans can see them.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Question for Dr. Roussin. We're seeing some grocery stores limiting the amount of beef shoppers can buy due to supply concerns. For people with larger families, if they're limited to, say, 2 ground beef products, that means they kind of have to go back to the store more often, which, of course, is something you're not advising. Should the stores be imposing limits to protect the supply, or does it actually kind of just put shoppers more at risk and kind of place them in danger if they have to go out more often? What are your thoughts on that situation?
I think it's a balance. I mean, certainly we haven't given any specific information or guidance to stores on to limit anything in particular. Certainly we have the guidance on to ensure the physical distancing takes place in these stores. And our message right from the beginning was that, families, individuals didn't need to panic buy or buy lots of products at the same time. And then certainly it's a balance. But we haven't made any specific recommendations to that, so it's hard to comment on any on any of those specific things. I mean, the most important thing is that those places are open, that they're allowing for physical distancing, and I would encourage Manitobans, to buy what they would last, if they can, for that week, for that 2 weeks, to minimize their exposures outdoors.
And as a follow-up, just a question on kind of, are we still seeing about 10% of cases of COVID-19 linked to community transmission? Are there kind of more cases of community transmission happening recently? I know early on it was very much international travel or close contact with another positive case, but has that balance shifted, and are we seeing kind of more community transmission these days?
Yeah, so we're seeing quite low numbers as we see these days. So some of those are community transmission, which we would say we're unable to link to a known case or to travel. So overall, we are about 53% related to travel, 35% related to a contact to a known case, and about 13% unknown acquisition, which which we would label as that community-based transmission.
From the Winnipeg Sun, Scott.
Hello, Scott Billick here from the Winnipeg Sun. I guess the first question for Dr. Roussin. Would it be safe to say right now, I mean, we're about 10 days out from May 1st and when the current public health orders will be renewed or amended or modified or whatever. Is it safe to say at this point that they will remain fairly similar?
No, I don't think I can comment specifically on that. These things we're reviewing all the time. If we needed to change them even earlier, we could. So before issuing new orders at that time, we're going to reflect on our numbers, see if there's any indicated changes that that we should make for those orders. So I can't specifically mention what those orders will look like right now because it's still in flux. We're still waiting to see some of these numbers. We're still doing some plans for how we may be able to reopen some of the economy. And so we're going to have to look at that closer to the end of next week before we know what those orders are going to look like.
Fair enough. And the second question probably for you as well, but do we know how many people have gone into the ICU and have been recovered enough from the ICU and have been moved out of there? I know 5 of the deaths have been stated that they were in ICU, but how many people have gone into the ICU and have moved out of that or recovered well enough?
Yeah, I don't think I have that information. I think yesterday there was a question on the average length of stay in the ICU, and that was 10.6 days for overall. But I don't have a number on the numbers that are recovered from ICU in front of me.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. It's Mohammed from CBC Radio Canada. I had a question about schools. How Manitoba will deal with the reopening of schools? In Quebec, for example, the Premier said that he thinks that it's not a good idea to massively send children back to school on the 1st of September. So they are thinking about send children back to school a few weeks before summer holidays. So what do you think about that?
Yeah, so I think it's going to depend on what things look like. So certainly one of our initial public health interventions was the suspension of classes. And so certainly we're looking at that as we reopen things, what the school situation is going to look like, and we don't have anything set for that. And certainly we don't know what things are going to look like in the late summer or early fall. So it's going to really depend on the numbers we see. Certainly by that time, we're definitely going to have some changes to our public health approaches, and so it's going to really depend on the response to the epidemiology based on how we start reopening our economy.
Thank you. And as a follow-up, sorry, you maybe answered this question before, but can you explain why is it important to expand your testing criteria?
Yeah, well, I think that we, given a certain prevalence of a condition, we want to have a certain amount of testing. So right now, given our positive test proportion is quite low, it's around 1%. We don't want to overdo the testing because we'll be using resources for a very low yield, but we still want to ensure that we're picking up on any community-based transmission prior to opening up our economy. So we want to make absolutely sure that we are picking up on that, and then we know that when you open up the economy, there is that chance that we're going to start seeing more cases. And so we definitely want to make sure we have the ability to ramp up testing should that occur.
From CBC Manitoba, Bart.
Dr. Roussin, is it safe to say then if we have 4 new infected healthcare workers, and we've only had a handful of new cases in the last week, that healthcare worker infections are responsible for most of our new transmission?
Well, based on those numbers, we know of those 4, and we sure haven't had a number of cases otherwise to report. But it's relatively short time, so it's tough to make generalizations over that. So certainly we do have those 4 that are reported, but tough to make a generalization over that just over the 1 week like this.
Okay. Earlier today, the Premier mentioned that Manitoba is looking at other jurisdictions as models, good examples for reopening the economy. When he was asked about which ones, he said, Dr. Roussin can tell you more about that later. So let's make the Premier happy, Doctor, and tell us which are the other jurisdictions that will be good examples.
Well, I think any jurisdiction would be good to look at, and we're certainly working together at the Special Advisory Committee, the Council of Chief Medical Officers of Health, on our overall plans to start reopening things. Of course, we all realize that the different jurisdictions are at different stages in their outbreaks, so certainly things will look different in jurisdictions, but we would look at ones with similar epidemiology to us. So certainly Saskatchewan has a similar timing and certain similar epidemiology to Manitoba, so we would pay close attention to any interventions that they were making and follow the impacts of that.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, there was a question earlier about people who recovered from ICU. I know you don't have the numbers in front of you, but are you learning anything about treatment for COVID-19 based on what may be helping people move out of ICU and recover?
Well, I think we were learning most about the risk factors right now for COVID-19. So certainly we know that age over 60 is a significant risk factor. We know that cardiovascular illness is a significant risk factor, especially hypertension, and as well as respiratory illness. So those are the factors there. We don't have any proven effective therapies yet for COVID-19. And so we haven't learned a lot about necessarily the therapy at this point. There are studies ongoing, so we hope that a development in a pharmaceutical intervention would certainly be able to change our approach to this virus.
And my follow-up question is for Ms. Siragusa. Have there been any instances in the isolation ward where N95 masks have not been available? I understand that there might be 2 issues at play, which is the general supply and then the access to some equipment that sometimes can be kept locked away. Mm-hmm. But have you heard of any examples where workers have not been able to have N95 masks when required?
No, I have not.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. Dr. Roussin, in regards to testing, why go over the clarification on who's eligible? Is there maybe a thought that there's people out in the community who have minor symptoms that don't think they need one?
Well, I think that for a long time we've been discussing the short supply of testing, and we had limited criteria, and so now we're opening up because we want to be able to ramp up our testing to be able to open up or look to open up the economy. So we want to make sure we're getting adequate testing numbers in to ensure that we're picking up on any community-based transmission. So I think that when we're messaging essential services, some people who are may not have understood how broad that is. It's basically anyone who's working right now is considered that essential service. So we just want to ensure our testing capacity is good. We want to get those testing numbers up to help guide our opening of the economy. And we want to ensure that we have a lot of testing capacity left for when we do open up the economy to ensure we can respond.
Okay, and just follow up to that, when you do move to letting some businesses open up, what sort of guidance may be given to business owners on how to do that safely?
Well, overall, the biggest guidance is going to be that physical distancing. So whatever business it is that opens up, they're going to have procedures in place to ensure that staff as well as patrons are going to be able to maintain that physical distancing for the most part. So that's the biggest thing. And like I say, well, it's certainly not going to be a return to normal. It's going to be a new normal. And so as we do this, we're going to do it very gradually and very cautiously.
From City News, Stephanie.
There's Stephanie from City News. We're about 10 days after that long weekend that you guys were a bit concerned about. And just wondering, we're still seeing low case numbers. Does this say something good about Manitoba's behavior on that weekend?
Well, I think the early indication is yes. It's still a little bit early to conclude that. We usually look for that, at least a full incubation period, and usually incubation period plus a period of infectiousness. So more getting into that 18 to 21 days after it is when we'd be fairly confident about that. But certainly early indication isn't showing us a climb in cases.
And then just a quick follow-up. Do we know how the 4 new cases from healthcare workers, how they contracted the virus, or is there any concerns about improper individual use of PPE?
Well, I just got an overview, not individual reports, but it sounded like they were all using PPE, and they're feeling pretty good about the spread, that it probably was very minimal, but they're doing the contact tracing now and will be able to confirm. But the PPE was available, it was worn, and and it was at work that they received COVID.
From the Winnipeg Free Press, Danielle.
Good afternoon. Danielle De Silva from the Free Press. Dr. Roussin, several other provinces have announced that they've reached or passed their COVID-19 case peak. We're wondering, have we reached our peak in Manitoba, or are we past it, and when did that happen?
Yeah, I can't give a definitive answer on that. Certainly the shape of our curve has been quite flat as of late. And so it's really difficult to know if we've reached a peak or not. I think I can certainly say we still see this virus here. This virus is still circulating here. We're still picking up on cases, so that if we loosen up too early, we're going to see a climb again, regardless of whether this represents a peak or not where we are. So we have to continue to be careful. The shape of this curve is a large reflection of the work Manitobans have done. If we scale that back too quickly, we'll see cases climbing again.
Thank you. And just as a follow-up, what do you believe is the risk of releasing the current modeling projections to the public?
Well, I don't think there's much of I don't perceive it as a risk. I think we are going to be releasing data and fairly soon. I just can't commit on a specific date, but we're going to do that soon. So I didn't really perceive it as a risk. I don't think anyone perceived it as a risk. It was just whether we could provide useful data, something that Manitobans would find useful. And so we're working on that. We think we can get something together to give Manitobans a bit of a picture, knowing that these aren't, you hear it in other jurisdictions, these aren't crystal balls. We've seen projections released from other jurisdictions, and actual numbers are not matching up, and that's to be expected. But we're going to try to get a presentation together to share with Manitobans that we hope they will find useful.
From CHTM, Navi.
Good afternoon, Navi Bell with CHTM. My question is for Dr. Roussin. I just wanted to ask about the letter that was sent to you from Northern MP Nikki Ashton about the concerns that were apparently raised to her about the hydro construction camp in Kiev from workers in First Nations communities, specifically about the 10 new employees expected to work in the encampment soon. Can you clarify if this is following the public health orders, and can you give a general response to the letter?
So in these remote work camps, we have been in contact with them and helping them plan to reduce the risk of introduction of the virus there, and certainly the risk of spread if it was introduced. So there's a number of safety factors in place, like screening daily and the ability to isolate quickly if anyone did become ill. So we've looked at these sites. We've looked at them with a number of our medical officer of health. We looked at them with public health inspectors, and the process that's in place we feel is adequate to prevent the risk. And so we'll keep monitoring the situation as it goes.
And sort of as a follow-up, you've mentioned that you've been in contact with people, but have the workers or First Nations communities been in contact with your office specifically about these concerns? Has there been any sort of dialogue about this specifically?
There hasn't been with myself, with a First Nation concern about this community that might be dealt with through the Northern Health Region. I'm not sure, but I haven't been contacted from a First Nation community about this specifically.
We have some time left today, so if media have further questions, please proceed.
Diana from 680 CJOB here. Dr. Roussin, at the risk of sounding like a horribly broken record, has there been any update on where Manitoba is death from COVID-19? Again, the woman in her 60s from Prairie Mountain Health Region picked up the virus. Of course, now we're finding that there is some positive cases popping up in healthcare workers more recently. Any indication where she may have contracted COVID-19?
Yes, I don't have a definitive answer. I don't think we have an answer on for sure where that was acquired. Given it's a 14-day potential incubation period, sometimes that's the way it is. So I don't think I have a specific answer to that.
Okay, thank you.
Dr. Roussin, it's the Cavis here at CBC. I know you've been asked repeatedly, but let's say we had opened the floodgates to all symptomatic people right now. What is your capacity right now, maximum capacity to test a day? We've seen 1,100. Is it 1,100? Is it 12? I know the Premier wants to get to 2,000. What's the max capacity right now, assuming you had tons and tons of people coming in?
Right. So if we look at, when we say capacity, we can all imagine that means the max capacity means all the machines working, all staff present, all materials present, right? Reagent, swabs, viral transport media. If that's there, then certainly at CADM Provincial Lab, we can certainly do 1,100 tests per day. That's certainly where we are at with max capacity right now. And then we have the ability to do extra tests at Dynacare as well.
And humor me, you have answered this question several times, but why not just open up to all symptomatic Manitobans now that we're only still seeing 300 or 400 people coming in and needing tests every day?
Yeah, and that's I think we're still seeing the effects of this recent expansion. I suspect that the messaging hasn't been clear enough. The vast array of people who are eligible right now for testing. So we just want to do that so we don't end up overwhelming the system if we get a 3,000 or 4,000 tests done in a day and overwhelm the lab. That's not going to work out well either. So we want to see what the actual demand is from this when we get the messaging clear. And certainly at some point that is our hope that we could open up to testing just all symptomatic Manitobans. But we need to be careful with that. The symptoms are quite common. We're getting into allergy season right now too, so we're going to start seeing a lot of the sniffles, a lot of cough. So we want to ensure we're saving our capacity for those at highest risk, but we are working towards that.
Dr. Roussin, Marnie Blunt from Global News. This may seem fairly obvious, but just so people are aware, can you explain why we're looking at opening up some certain non-essential businesses before schools are open? Can you just kind of explain the logic behind that?
Well, I think that there isn't a clear guideline for any of this. Right, so we are looking at ways to do this in the most cautious way, and so we see non-essential businesses that we feel we are able to open up with maintaining strict physical distancing strategies. With the schools, some of that is timing. We want to do it cautiously, and we're coming close to the end of the school year as well. So it's tough to necessarily know how much of that we could get in, even if we were planning on that. And so I think that our first plan, the first wave of our expansion, is going to focus mostly on the non-essential businesses, and then and really monitor very closely the effects on our numbers.
Dr. Roussin, Scott Billick from the Winnipeg Sun again. Can you expand on what those non-essential businesses might be? Is it going to be, lesser healthcare services like maybe physiotherapy, or is it just increasing gathering limits, as the Premier said today about allowing weddings and funerals to take place and stuff like that? Is there any idea of what these businesses actually may be?
Yes, I mean, we're actively looking at that, and then actively looking at the guidance towards the different types of business. So I don't really want to comment specifically on it because it's still a work in progress on which ones in the first wave. Right? So we're planning on rolling this out in a number of different waves because we need to do it cautiously. So I don't want to specifically mention on which businesses may or may not be in the first wave because it's still a bit of a work in progress.
Bud Robertson at the Sun, do you have concerns that dentists, chiropractors, others are going to be overwhelmed once this is over? Then the restrictions are looser. Then people might be waiting months and months to go in for their back fracture or whatever.
Well, I think there's all of these decisions we made have consequences. We've delayed some of the non-urgent medical procedures, non-urgent diagnostic exams as well. So as we start rolling this back, we need to to ensure we do it in a smart way, in a gradual way, in a cautious way. But during this whole period, these providers are still able to perform urgent or emergent procedures. So as we look here, these elective procedures, they were by definition procedures that wouldn't result in negative impact in the short term. So we're not planning to see a large backlog like that.
Great, thanks very much.
Danielle De Silva here from the Free Press. I was just wondering, of the 4 new healthcare workers who've been identified for positive COVID-19 cases, can you describe the extent of the community contact those workers had inside and outside of working hours?
No, I don't have those details. Sorry, but I can see if I can find out.
Michelle from...
Dr. Roussin, Barley-Kiva, CBC. Oh, go ahead, or Danielle.
It's Michelle. Just wondering, of those 4 new cases in healthcare, where were they contracted? Was it on the job?
I believe 2 of them were on the job, and the other 2 I cannot confirm at this time.
All right, Dr. Roussin, what does the new normal look like to you?
So, looking forward in the foreseeable future, we're not going to be seeing large group gatherings for some time. What that time looks like, it's difficult to predict. But large group gatherings are not a thing in our foreseeable future. And even when we do start moving the economy, things like that physical distancing are going to be in place for quite some time. And so we need to anticipate more than one wave of this. And so we'll have to adjust accordingly with our public health measures if needed. So we're going to be dealing with this virus for quite some time.
How long is a long time in terms of large public gatherings? Weeks, months, years?
Yeah, and it depends on what we say as large. And so certainly months. For the next number of months, we're not going to be seeing the large group gatherings. Certainly, it's not going to be restricted to 10, for months. But large group gatherings, we're going to have to continue to restrict them in some shape or form.
So, do you see in any foreseeable circumstance where you would be sanctioning, as the province of Manitoba, tens of thousands of people at a Canadian Football League or National Hockey League exhibition in the fall?
Yeah, it's tough to answer, and I think there's probably going to be a lot of work being done on that right now. Given where we are and how little we know about the second waves of this virus, we'll certainly be cautioning against large group gatherings for quite some time. Again, it's tough for me to say is that going to extend all the way to fall or not, but it's certainly it's not going to be back to normal for quite some time.
And that concludes today's media briefing. Thank you.